Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In continuation with the Module 2 on patient safety, we will be discussing in today's chapter 16 on patient safety measures. So what are the measures that we need to take for patient safety? We will see why do safety problems still occur in healthcare, which are very inevitable. And no doubt when we take the measures, what are the impact which are being seen. In the introduction, we would like to focus on what is there in the depth of patient safety to be seen as so prime important. The modern focus on patient safety began with the Institute of Medicine, that is IOM's influential 1999 publication. To error is the human, building a safe health system was the name of the publication, and this was the first report which highlighted into the history of medical sciences that there is an emphasis that need to focus on something on the human error part. This report made an emphasis on building a safer health system. Patient safety is defined by the AHRQ, that is Agency for Healthcare Research and Quality, the epic body working on patient safety. It is defined as freedom from accidental or preventable injuries produced by the medical care. Medical care has greatly improved. We have been witnessing it, leading to longer, healthier lives through safe procedures, advanced equipments, and skilled staff. A long way that we have come up. Despite this advancement into the medical care, patients still suffer unintended harm in the hospital. They still face so many issues actually that we need to think on the part of patient safety. The examples of patient safety can be the infection caught in the hospital, hospital acquired infection by the superbugs and those species in the hospitals, bad reactions to medicines, which might be due to different causes, injuries from patient fall, an entire patient safety issue, delays in treatment, which are more because of the process delays, protocols and practices of the hospitals, not following standard treatment rules, which is very important with respect to the culture of the hospital. So many of these harmful incidents could have been prevented. This could have been reduced. This could have been managed, which are raising global concerns. Even when the skilled staff and good resources, problems happen because the hospital environment is complex and risk. The higher the risk, higher the complexity, more the chances of going wrong. There are many chances for things to fail, which can harm patient if not addressed. The ancient principle to do no harm was not always emphasized in the past. The reason was of ethics, trust, equity, emphasis on the patient. And over the last 20 years, there has been a worldwide attention on the facts that patients are hurt or die from preventable medical errors. We need to work on the preventable medical errors. This affects all countries and not only our own country, India. Because of this focus, patient safety is now a vital topic that stress on safety practices, reporting incidents, analyzing problems, taking action to fix and prevent errors. Why do safety problems still occur in healthcare? Even after emphasizing on this, there are some complexities which are pending. The hospital complexity and systems. Hospitals are risky environments for patients and staff. The potential for patient harm is comparable to risky activities like bungee jumping or mountain climbing. where you cannot really gauge the risk. The risk is inevitable. But do we need to think on this part to work on to reduce the risk? Yes, it is. The risk exists because the hospital is a complex system with a very high variability. It involves many interconnected parts. The part can be first seen as people, second seen as processes, third seen as equipment, and fourth seen as interdependencies among all these. All invasive medical procedures carry a risk of problems. Harm can result from even a small mistake in a process. The process can be a medicine given, a hand hygiene not done properly, delays in treatment, delays in processes, patient identification issues. Also, surgical safety is critical since most of the hospital perform operations, which is a very important area in relation to patient safety. Problems usually stem from many of the things. Issues with the overall system going wrong, identified being seen as gaps in the training, poor communication among the healthcare employees, differences in how tasks are done, especially the process variation part. There are few examples that I would like to discuss. That is, during a patient stay, they often need some special medical test, very essentially like x-rays or blood work, to guide treatment. The doctor may order the wrong test. The lab technician might mix up the tube from different patients. The staff member performing the test might not properly position the patient for an accurate result. The attending doctor may overlook a critical finding in the result because they were distracted. And of these above steps could lead a wrong diagnosis or delayed treatment, which is causing a severe harm to the patient. And if you can see that if most of these steps are coming closer or are mixed, what a havoc a patient can face. There are always being seen as very human factors very much responsible for patient safety issues. Healthcare services depend heavily on people. It is a care given by people to the people. A single patient during a multi-stay might be cared by 20 to 40 different individuals. The individuals can be doctors, nurses, technicians, and many other people in the house. They can give so many hospital acquired infection if the hand hygiene and sanitation protocol or infection control practices are not followed properly. What does it highlights? It highlights the high chances of human mistakes. The most common error can be conducted by a human. The likelihood of unintentional errors that hurts patient is increased by human stress, human heavy workload, and human driven complex work system, where I have to emphasize more on that human factor plays a major role in patient safety. What are the reported problems? Most hospitals share similar safety issues. These are at the time of process breakdowns. Common problems that can harm patients include medication related errors, which are very common in this ladder. Commonly next seen are infections, incorrect patient monitoring, surgical complications, patient falls, bed sores, you can say bed sores or pressure sores, and patient identification error. Here are few examples where I want to emphasize more on how it goes that patient safety is compromised. In the case A patient receiving an IV infusion was critically injured when the nurse accidentally programmed the pump with an incorrect rate. The rate was very high or the rate was very low. An investigation found the nurse was covering two wards simultaneously, means she was worked up. A stress might be many other issues she might be facing which has made this mistake to be happen, leading to high stress and a failure to double check the calculation, which is very important when the employee has not done this. In the case 2, a patient was scheduled for an operation on the left knee. What happened next? The surgical team marked the correct knee. But due to a last minute change in the operating room, the pre-operative checklist was skipped. What happened next? The surgeon mistakenly began the procedure on the patient's right knee, which was very unexpected. But due to the inevitable situations and the last minute change made this happen, requiring a further corrective surgery of the patient, where the major issue of patient safety has happened over here. Now, when the hospital is taking the patient safety measures, what is the impact that needs to be seen? Extent of the problem. Up to 1 in 10 patients in richer nations are harmed while receiving care in the hospitals. These are the privileged countries that we can count where 1 in 10 patient is facing this issue. For every 100 hospitalized patient, 7 in developed countries and 10 in developing countries will get infection linked to their healthcare. And this has been seen or witnessed during the time of COVID. Hundreds of millions of patients worldwide are affected by safety issues yearly. We get so much of a data of most of the patients who are affected with many disease infection only because of the hospitalization. About 234 million operations are performed globally every year. So you can understand what is the pressure of surgery on hospitals. Surgical care carries a high risk of complications, which takes a whole volume of the hospital employees and resources and equipments. Errors during surgery cause a significant amount of illnesses, which puts major issue to the patient and patient's family, patient's mental health, and even on the revenue. Even though half of these problems could be prevented, which is reported from the data and research. The level of harms to the patient. The level of harm can be at a level of adverse event, a medical problem that happens because of the care given. It might have been preventable or not. Adverse event. There is a second called as near miss event, a mistake that could have been caused harm but not noticed and stopped. Reporting this helps improve patient safety, which you can find at key O at a moment it could have caused. The third is no harm. A mistake happened, but it did not negatively affect the patient. Okay, like it has happened, but it has not resulted to the level that you expect that this is called as a patient safety issue. Example can be giving 2 paracetamol tablet instead of 1, but with no bad effects. So you can say it is no harm, but it is a fault. Second example can be a patient falls in the bathroom but is not injured. Yes, there was a wrong but has not reflected to harm. But you can say if at all the patient would have injured, what could have happened? And the last is adverse drug event, ADR. A harmful event caused by errors in prescribing, might be by the doctor, might be by putting the notes, preparing and recording or giving the medicine, which usually comes to the nurses, or even by giving a medicine can be a pharmacist. Many of these players who are there involved into this entire action can be taken in causing actually the adverse drug event. Then comes the sentinel event, where we don't expect a sentinel event to happen in an hospital. An adverse event that leads to serious injury or it can cause a death. The patient can get an injury which cannot be repaired, or sometimes it is very difficult for the hospital actually to repair all those parts, or sometimes the hospital has to see a death of the patients because of this event. So this include unacceptable incidents like surgery on the wrong person or a wrong body part, where there are many examples where you have seen wrong person are chosen, wrong body part is chosen. Global accreditation group list examples like wrong body part surgery, wrong device used, patient suicide, falls, medication errors, and crime like assaults to the patient. So you may find this list is only giving few examples, but there might be many such individually hospitals are encountering with. These serious events require complete review of the system, a thorough root cause analysis, and a culture from the hospital to put major corrective actions in place if the hospital is developing a culture of quality. Many reports document how often different types of errors and adverse events happen globally. What should be the outcome? The outcome should be preventable harm has seen severe results for patient and their family. It also seriously affects clinicians also, nurses, doctors, technicians and all other staffs. Negative outcomes for the patients and hospital, which is very serious issue to be concerned. Low patient satisfaction, worse quality of life, longer hospital stays, and higher cost per patient, and lastly, reputation damage and legal trouble for the hospital, which a hospital really don't like to take on. What is the family to be affected as? The family seeks justice. They experience loss of trust. They face sudden grief, morass. If the harmed person was an earner, family faces intense pain. Family go in a great grief, sometimes leading to violence, aggression, and even vandalization. They struggle to cope up with the loss. It becomes very difficult for the hospital to put their team on breaking the bad news. Also, the families seek compensation from the hospital through all the legal remedies they have. What is the problem of patient safety a clinician has to face? They suffer a traumatic experience. They, as a human, have a severe effect on their working process. They have a low morale. They lose respect from their colleagues and the organization where they are working, and it finds them very difficult to cope up the situation. Sometimes the clinicians lose their reputation and it is even being damaged. The clinicians face the potential loss of their career, which is very unrepairable. Many times it has been seen that a clinician face criminal charges and they have to run to the court or even to police stations. That is under the cases of medical negligence or consumer protection. Clinicians also suffer long-lasting emotional pain. So what is the time now? Now it is the right time to bring the change. We need to think on patient safety issue. Hospital need to work on quality. We have strong proof that many patients are harmed by their medical care. The care for what they have gone to receive, the care for what they have reached the hospital itself has caused harm to them. This harm can cause lasting injuries, longer time spent in the hospital, or even sometimes a death. Over the past 10 years, we have learned that problems happen not because the bad staff, or not because that the staff was not skilled, or not because the hospital doesn't give them enough support, but because of system failures. There is the normal accident theory or switches model, which can make it more clear that how system failures can lead to major patient safety issues. Getting a patient better depends on many things and not just only on one doctor or a nurse's skills. If at all it was there, a doctor one who could have saved the entire life of a patient. Lot of dependencies are there on the angle of the patient to be treated by a doctor or a nurse. That is the entire teamwork that they need to see. Since many people are involved, like doctors, nurses, pharmacists, social workers, and administrators, and many other people from housekeeping and all, we need a system that supports teamwork. A teamwork actually which provides quick, easy ways to share the information rather not keeping it halted. This is how we can have a high quality care that still feels personal. Patient safety is important for all countries with health services and not only bestowed in the hands of fewer people actually, whether they are paid for or whether they are coming from private companies or the government. Everyone has a right to go for a patient safety. Mistakes like operating on the wrong body part, giving the wrong medicine, or using an antibiotic very incorrectly, or giving a bad dose, or a bad reaction to drugs cause unnecessary harm. Additionally, poor patient check or even bad communication and not using technology well can hurt both patients and the staff, which can render issues of patient safety. Following good medical habits, sticking to standard ways of working, and achieving positive results for patients should be the normal expectation for all caregivers. Some people work that they are wrongly believing that making safe care will be costly or make more money actually. So safety actually requires a strong focus on using good safe medical practices and rather not only pumping money to get it. So we need to encourage everyone to improve system efficiency, better documentation, providing regular training, and report mistakes or harmful events, rather not suppressing. So doing this all what is being stated will help us to find a sensible way to reduce medical errors and ensure safer care in securing the setting. Here is the framework for patient safety from system point of view, where you find the standard procedures, clear communication, reliable equipments, and error reduction. With respect to humans who are involved in the entire hospital or healthcare gamut, that emphasize more on the teamwork, staff training, team and collaboration, workload management, and fatigue prevention. With respect to skills and development and education and training, information and learning, where good documentation needs to be emphasized, incident reporting is very important, analyzing the mistakes with respect to the data what is being taken to the hospital and working on those mistakes or analyzing them in form of feedback and education. Technology and tools can also help to enhance or to improve the continuous improvement cycle of the quality, that is through the help of electronic health records, smart pumps, barcoding mediations actually, which is very important nowadays, being seen as a very standardized practice, and decision support. A commitment to quality and reliability is where we can find that the safer, less harm, and trust and better outcomes can lead to patient safety. So in summary to this chapter, patient safety focuses on freedom from accidental or preventable injuries produced by medical care. Following the influential 1999 IOM publication to Error is Human, which is very emphasizing on doing no harm. Despite the medical advances, patients still suffer unintended harm in the hospitals, and many harmful incidents could have been prevented, which is being seen from lot of reports and research. Hospitals are complex, high-risk environment where problems often stem from issues with the overall system and not only by one individual person. Poor communication among the staff and even to the patient, gaps in training which are a pending issue of most of the organization, and process variations from one process for one thing and other process for other thing. Healthcare dependence on people. Many times it is seen that a single patient may involve 20 to 40 or more people actually, which leads to high chances of human mistakes rather than not working on reducing it. And additionally, this is exacerbated by stress, heavy workload, and the complex work system which is evolving day and day and making it more complex. Upon to 1 in 10 patients in the richer nations are harmed while receiving care, and global infection linked to healthcare are common and increasing. Many times, particularly for Indian hospitals, it is said that Indian hospitals are a breeding ground of infections. Indian hospitals face lot of vandalization, especially in government hospital against the healthcare employees. The treatment protocols are not followed, standard treatment guidelines are not there. So you may find major risk coming to the patient's head. Surgical care especially carries a high risk of complication, and many times it has been related that this care can be a preventable care, and you may find the errors which come from the surgical care could have been most of the time prevented if you do follow simple things like surgical checklist. So, in continuation to this, the severity of incidents range from no harm, that is mistake with no negative effect, or near miss, that is mistake stop before harm happen, or adverse event, that is a harm from care which has lead to a major problem, and the most severe is the sentinel event, that is a death or a fatality which leading to severe injuries or death. Example, wrong part surgery, wrong medication, choosing a wrong site, which gives the sentinel events to occur. So common problems include medication related errors, tops the first, infection or HAI particularly, or hospital acquired infections are the second one, patient falls which are very important to be seen as a third, fourth is surgical complications which are very much preventable, and patient identification errors which stands for fourth. So the negative outcome includes severe results for patients and their families, which you can say the adverse effects on clinicians, lower patient satisfaction, longer hospital stay, higher cost per patient, and reputation damage, which can lead to a legal trouble for the hospital to go for litigations, which creates a problem of trust for the hospital. So patient safety stresses safe practices. It emphasizes more on reporting the incidents and also on analyzing the problems and taking actions to fix the prevented errors for their part. So coming to an end, would like to emphasize more on putting these references to work on your projects and exploring actually what the institutions are really taking steps for improving the quality. So thank you for this.